Did you know there's one vitamin that could literally make the difference between walking confidently in your 60s or struggling just to stay balanced? For many people over 60, everyday activities like climbing stairs, walking to the grocery store, or even standing up from a chair become more difficult than they ever expected. But here's the surprising part. It's not always age itself that takes away your strength. Sometimes it's a hidden deficiency that weakens your bones, drains your energy, and quietly raises your risk of falling. The good news is that science has shown a simple way to fight back. With the right nutrient, you can support your body to stay active, independent, and strong, no matter your age. And in this video, I'll reveal the only vitamin proven to play a key role in keeping you walking strong after 60, and how to make sure you're not missing it. Hello, I'm Dr. Emily Carter, and welcome to my channel, where we make health simple, practical, and science-based. If this is your first time here, I'm so glad you joined us today, because we're about to dive into a topic that could change the way you age. Every year, millions of people over 60 begin to notice changes they never thought would happen so soon. Stiff joints, aching bones, and that sense of slowing down can feel discouraging. Some even start to worry, is this just how it's going to be from now on? If you've ever had that thought, you're not alone. And the answer is, not necessarily. The truth is, there's one vitamin that plays a far bigger role in your health and independence than most people realize. It's not just about numbers on a lab test. It's about how easily you can get up in the morning, whether you feel steady on your feet, and how much freedom you'll keep as you get older. That's why this conversation matters. In today's video, we're going to talk about the only vitamin that truly makes the difference between staying strong and mobile, or slowly losing the independence that matters most. And here's why you'll want to stay with me until the end. I'll be sharing 3 practical, science-backed tips that you can start applying right away. These tips are simple, safe, and designed to support your body's natural strength after 60. So, if you've ever worried about losing your mobility, about becoming dependent on others, or about missing out on the activities you love, stay tuned. Because by understanding this one essential nutrient, you'll gain tools to protect your health, your freedom, and your quality of life. Now, let's set the stage and talk about why mobility and strength after 60 are such important issues, and how this vitamin connects to them in ways you may have never considered before. Let's start by looking at the bigger picture. When we talk about aging, many people immediately think about wrinkles or gray hair. But the real challenge of aging isn't how we look, it's how we move. Mobility is what gives us independence. It's what allows us to go for a walk, cook for ourselves, visit friends, or play with our grandchildren. Without mobility, even the simplest daily routines can feel overwhelming. Here's a surprising fact. After the age of 65, 1 in 4 adults in the United States experiences a fall every single year, and those falls are not always minor. They can lead to fractures, hospitalizations, or long-term disability. Worldwide, falls are actually one of the leading causes of injury among older adults. Now, you might wonder, why do some people in their 60s or 70s walk with confidence and energy, while others the same age appear frail or unsteady? The answer isn't always genetics. In many cases, it's about the health of their bones and muscles, and whether their body is getting the support it truly needs. Our bones naturally lose density as we age. The process can start earlier than most of us realize, often in our 40s, and it accelerates after menopause for women and later in life for men. This gradual loss of bone strength increases the risk of fractures. At the same time, muscles tend to shrink and weaken, a process called sarcopenia. Together, these 2 changes can dramatically impact mobility. But here's the good news. These changes aren't entirely out of our control. Studies show that nutrition plays a huge role in how quickly bones and muscles decline. And among all the nutrients we need, there's one vitamin that consistently stands out as essential for keeping bones strong, muscles working properly, and the risk of falls much lower. Before I reveal exactly what this vitamin is and why it's so powerful, let's pause for a moment and think about this question. If staying active and independent after 60 came down to one daily choice, wouldn't you want to know what that choice is? That's exactly what we're uncovering in this video. So now that you understand why mobility matters so much and how widespread the risk of decline really is, let's move into the heart of the topic, the vitamin that can make all the difference. So, what is this powerful vitamin that plays such an important role in keeping you walking strong after 60? It's vitamin D. Now, you may have heard of vitamin D before, often called the sunshine vitamin. But what many people don't realize is just how deeply it affects mobility and independence. Vitamin D isn't just another nutrient on a long list of supplements. It is a critical factor in how your body maintains bone strength, muscle function, and even balance. Here's how it works. Vitamin D helps your body absorb calcium, the mineral that builds and maintains your bones. Without enough vitamin D, even if you eat foods rich in calcium, your body won't be able to use that calcium effectively. Over time, that means bones become weaker, more fragile, and more prone to fractures. And as you can imagine, weak bones are one of the biggest threats to staying mobile after 60. But vitamin D does more than protect your bones. Research has shown that it also supports muscle strength. People with low vitamin D levels often report feeling weaker, more fatigued, and less steady on their feet. In fact, some studies have found that seniors with sufficient vitamin D levels perform better in simple physical tests, like standing up from a chair or walking a short distance, compared to those who are deficient. That means vitamin D has a direct impact on your ability to move with confidence. Think of it this way. Strong bones are the foundation, and healthy muscles are the engine. Vitamin D helps with both. Without it, the foundation starts to crack and the engine begins to stall. With it, you give your body the tools to stay upright, steady, and active. Another fascinating point is that vitamin D even plays a role in how your nerves communicate. That means it can influence coordination and balance. When you put all of this together, stronger bones, stronger muscles, and better balance, you start to see why vitamin D is often considered one of the most important vitamins for older adults. So, the next time you hear the phrase, the sunshine vitamin, don't just think about summer days. Think about walking into your 70s with strength, climbing stairs without hesitation, and enjoying the freedom of movement that many people unfortunately lose too soon. Now that we know what vitamin D is and why it matters so much, let's explore why so many people, especially after the age of 60, are not getting enough of it. So, why is it that so many people, especially those over 60 and up, deficient in vitamin D? The first and most obvious reason is sunlight. Our bodies naturally produce vitamin D when our skin is exposed to the sun. But as we age, our skin becomes less efficient at this process. A person in their 70s, for example, may produce only about a quarter of the vitamin D from the same amount of sunlight compared to when they were 20. That's a big drop. Then there's lifestyle. Many of us spend more time indoors than ever before watching TV, reading, or simply avoiding too much sun exposure out of fear of skin damage. While protecting your skin is important, the downside is that less sun means less vitamin D production. Geography also plays a role. If you live in northern regions where winters are long and sunlight is weak, your body may not make enough vitamin D for months at a time. Even in sunny countries, people often cover up with clothing, hats, or sunscreen, which again limits the amount of vitamin D their skin can create. Diet is another piece of the puzzle. Very few foods naturally contain vitamin D. Fatty fish like salmon or mackerel, egg yolks, and liver are some of the richest sources. In many places, foods like milk or cereals are fortified with vitamin D. But even then, the amounts may not be enough to meet your body's needs, especially as you get older. Here's something many people don't realize. Obesity and certain medical conditions can also affect vitamin D levels. Because vitamin D is fat-soluble, it can get trapped in body fat, making it less available to the body. In addition, health problems like kidney or liver disease can reduce your body's ability to convert vitamin D into its active form. The numbers are striking. According to studies, nearly 50% of older adults worldwide are deficient in vitamin D. That's half of the senior population walking around with lower bone strength, weaker muscles, and a higher risk of falls without even knowing it. Think about it this way. Deficiency often doesn't show obvious signs right away. You won't feel it the way you feel a headache or a fever. Instead, it's a slow, silent process that gradually undermines your strength. And by the time fractures or serious balance problems appear, the deficiency may have been there for years. This is why understanding the causes of vitamin D deficiency is so important. By knowing the risks, you can take steps to protect yourself. Now that we've seen why deficiencies are so common, let's talk about the warning signs your body might give you, and when it's time to pay closer attention. So, how can you tell if your body might be running low on vitamin D? One of the biggest challenges with this deficiency is that the symptoms can be subtle. They often creep in slowly, and many people mistake them for just getting older. But paying attention to these warning signs can make all the difference. The first is muscle weakness. If you find it harder to get up from a chair, climb stairs, or carry groceries than you did a few years ago, it might not just be aging. It could be low vitamin D affecting your muscle strength. Another sign is frequent fatigue. People with low vitamin D often describe feeling more tired than usual, even after a full night's sleep. It's a kind of tiredness that lingers and makes everyday activities feel heavier than they should. Bone pain is also a red flag. This isn't the sharp pain of an injury, but more of a deep, aching discomfort, often in the lower back, hips, or legs. Sometimes people assume it's arthritis, when in fact their bones may be struggling from lack of vitamin D. Frequent illnesses can also be a clue. Vitamin D plays a role in supporting your immune system, so recurring colds or infections could be connected to low levels. One of the most serious warning signs is an increased risk of falls. If you've noticed that you're losing balance more easily, tripping over small objects, or feeling less steady on your feet, low vitamin D could be part of the problem. That's because it impacts not only bones and muscles, but also the way your nerves coordinate movement. It's worth noting that some people may have no clear symptoms at all until a fracture occurs. Imagine walking across your living room, stumbling, and suddenly breaking a hip. For many older adults, this moment changes life forever, and vitamin D deficiency is often a silent factor leading up to it. So here's the takeaway. Don't ignore gradual changes like weakness, tiredness, or more frequent falls. They may not just be a normal part of aging. They could be your body's way of warning you that something essential is missing. In a moment, we'll look at how doctors can identify this deficiency clearly and what steps they use to confirm it. Because when it comes to vitamin D, guessing isn't enough. You need real answers. So, how do doctors actually find out if you're deficient in vitamin D? The most reliable way is through a simple blood test called the 25-hydroxyvitamin D test. Don't worry, the name sounds more complicated than it is. It's just a standard test that measures the amount of vitamin D circulating in your bloodstream. Doctors use this number to see whether your levels are healthy, borderline, or low. Here's what usually happens. Your doctor will order the test if you're experiencing symptoms like fatigue, bone pain, or frequent falls, or if you're in a higher risk group such as being over 60, spending little time outdoors, or having certain medical conditions. The blood sample is taken just like any other lab test, and results usually come back within a few days. Normal levels of vitamin D typically range between 30 and 50 nanograms per milliliter, though guidelines may vary slightly depending on the health organization. Anything consistently below that range suggests deficiency, and the lower the number, the higher the risk to your bones and muscles. In some cases, doctors may also check related markers, like calcium or parathyroid hormone, to see how your body is handling bone health overall. But for most people, that one vitamin D test provides the clearest picture. Why is this important? Because vitamin D deficiency is often invisible. You can't feel your blood levels, and as we mentioned earlier, symptoms can be vague or mistaken for something else. The test takes away the guesswork and gives you solid answers. Another important point, testing allows your healthcare provider to recommend the right approach for you. Not everyone needs the same strategy. Some people may benefit from adjusting their diet, others from more safe sun exposure, and in some cases, supplements may be considered. But without knowing your baseline, it's impossible to make the best plan. Think of it like checking the oil in your car. You wouldn't just assume everything's fine and keep driving until the engine fails. You'd check the levels and make adjustments before serious damage occurs. Your body deserves the same kind of attention. So if you've been feeling weaker, more tired, or less steady on your feet, it might be time to talk to your doctor about a vitamin D test. It's simple, quick, and could give you the clarity you need to protect your mobility. Next, let's look at how vitamin D is usually managed, and what general options exist to keep your levels in a healthy range. So, once a deficiency is identified, what can be done about it? The good news is that vitamin D levels can usually be improved with a few well-known strategies. Let's start with the most natural one, sunlight. When your skin is exposed to direct sunlight, it produces vitamin D. Even short periods, like 10 to 20 minutes a few times per week, can make a difference, depending on your skin type, the season, and where you live. Of course, safe sun habits are important, so it's always about balance. Enough light to support your health, but not so much that it increases your risk of skin damage. Next, diet. While not many foods naturally contain vitamin D, a few good ones stand out. Fatty fish such as salmon, mackerel, or sardines are excellent sources. Egg yolks and liver also contain vitamin D, and in many countries, foods like milk, orange juice, or cereals are fortified with it, which means vitamin D has been added to help people meet their daily needs. Including a variety of these foods in your meals can contribute to healthier levels. Then there are supplements. For some people, especially older adults, or those who live in regions with limited sunlight, diet and sun exposure alone may not be enough. In those cases, healthcare providers might suggest vitamin D supplements. These come in different forms, usually capsules or drops. The exact amount varies depending on your personal health, your current levels, and any other conditions you may have. That's why professional guidance is essential. You don't want to guess with supplements. Too little won't help, but too much can also be harmful. Another important aspect of management is consistency. Vitamin D isn't something you take once and forget about. Maintaining healthy levels requires steady habits, whether that's getting safe sun exposure, eating nutrient-rich foods, or following a doctor's advice on supplementation. Think of it as part of your long-term health routine, like brushing your teeth or staying active. It's also worth remembering that vitamin D works best in partnership with other nutrients, especially calcium. They're like teammates. Vitamin D helps your body absorb calcium, and calcium strengthens your bones. Without vitamin D, calcium can't do its job properly. So both matter if you want to keep walking strong after 60. So the takeaway here is simple. While aging does bring natural changes, vitamin D gives you a powerful tool to push back. With a mix of sunlight, diet, and when needed, supplements under medical guidance, you can support your body in ways that truly make a difference. Up next, let's focus on prevention and the simple daily tips that can keep your vitamin D levels steady and your mobility protected. Now that we've covered what vitamin D is, why deficiencies happen, and how it's managed, let's focus on prevention. These are simple, practical steps you can take every day to keep your levels healthy and your mobility strong. First, get some safe sun exposure. Even short periods of sunlight around 10 to 20 minutes a few times a week can help your body produce vitamin D naturally. Try taking a short walk in the morning or afternoon, or simply spend time in your backyard or on a balcony. Remember, the goal isn't to bake in the sun, but to give your body the light it needs to support bones and muscles. Second, eat vitamin D-rich foods regularly. Include fatty fish like salmon, mackerel, or sardines in your meals. Add eggs and other fortified foods such as milk or cereals to your daily diet. Combining variety with consistency ensures your body receives a steady supply of this essential nutrient. Third, maintain a routine of physical activity. While this doesn't increase vitamin D directly, it strengthens your muscles, supports balance, and reduces fall risk. Simple exercises like chair squats, leg lifts, or gentle stretching can make a big difference over time. Movement also helps your body utilize nutrients more effectively, including vitamin D. Fourth, consider supplements if needed. For many older adults, sunlight and diet may not be enough, especially during winter months or in areas with limited sun. Talk to your healthcare provider about whether a vitamin D supplement is appropriate for you. They can recommend the right form and dose, ensuring safety and effectiveness. Fifth, Combine vitamin D with calcium. These nutrients work together to maintain strong bones. Without vitamin D, calcium can't be absorbed properly. So make sure your diet includes both, either through foods or supplements as advised by your doctor. Finally, make it part of your daily routine. Small, consistent steps matter more than occasional effort. Sunlight exposure, nutritious meals, light exercise, and mindful supplementation all add up to help you maintain strength and independence for years to come. By taking these steps, you're not just supporting your bones and muscles, you're protecting your ability to walk confidently. Enjoy daily activities and live life on your terms. Prevention is always better than repair. And the good news is that these strategies are simple, practical, and entirely doable. Next, we'll move into some extra value content, where we'll bust common myths and answer frequently asked questions about vitamin D, things that people often wonder about but rarely get clear answers for. Now, let's add some extra value by addressing common myths and frequently asked questions about vitamin D, things that confuse a lot of people. First, the myth that vitamin D is only important for your bones. While it's true that vitamin D plays a key role in calcium absorption and bone strength, it also supports muscle function, balance, and even your immune system. That means having enough vitamin D can help you stay stronger, more coordinated, and less likely to get sick. Second, the idea that if you take calcium, you don't need vitamin D. This is not correct. Calcium is like the building material for your bones, but vitamin D is the worker that helps your body use that material properly. Without enough vitamin D, calcium can't be absorbed efficiently. So both are essential if you want strong bones and muscles. Another common question is, can I get enough vitamin D just from sunlight? It depends. Factors like your skin type, the season where you live, and how much time you spend outdoors all affect how much vitamin D your body can produce. For some people, sunlight alone isn't enough, and they need dietary sources or supplements. People also ask, is it possible to get too much vitamin D? The answer is yes. Excessive supplementation can lead to high blood calcium, which can cause nausea, weakness, and kidney problems. That's why it's important to work with a healthcare provider to determine the right amount for you. Another frequently asked question, how can I know if I'm deficient? Symptoms can be subtle fatigue, muscle weakness, bone pain, or frequent falls. But the only reliable way is a blood test, as we discussed earlier. Finally, some wonder if age alone means you should take vitamin D, while age increases the risk of deficiency. Not everyone over 60 is deficient. The key is testing and tailoring your approach to your individual needs. Here's a practical tip. Consider this as part of your daily routine, just like brushing your teeth or staying active. Consistency matters more than occasional effort. Sunlight, diet, and safe supplementation, combined with movement and balance exercises, can dramatically reduce your risk of weakness and falls. By understanding these myths and questions, you can make informed decisions about your health instead of relying on assumptions or incomplete information. Knowing the truth empowers you to protect your mobility and independence for years to come. Now that we've debunked common myths and answered key questions, it's time to recap the most important points and make sure you leave with clear, actionable takeaways. Let's wrap everything up and review the key points you need to remember. First, vitamin D is essential for keeping your bones strong and your muscles working efficiently. It's not just about feeling healthy, it directly impacts your balance, coordination, and your ability to stay active and independent after 60. Second, deficiency is common, especially as we age. Reduced sunlight, lifestyle factors, diet, and certain medical conditions can all contribute to lower vitamin D levels. Many people don't even realize they are deficient until they experience fatigue, muscle weakness, or even a fall. Awareness and testing are crucial. Third, there are practical steps you can take to protect yourself. Safe sunlight exposure, eating vitamin D-rich foods, staying active, and supplementing when necessary under medical guidance can all make a real difference. Pairing vitamin D with calcium and maintaining a consistent routine further supports your bones and muscles. Remember, staying strong and mobile isn't just about age, It's about the choices you make every day. By understanding the role of vitamin D and taking steps to ensure you have enough, you're investing in your independence and quality of life for years to come. So, think of this as a roadmap. Check your levels, make informed lifestyle choices, and embrace habits that support strength, mobility, and overall health. The benefits are real, and the impact on your daily life can be profound. With these key points in mind, you now have the knowledge to take control of your health and make sure you can walk confidently, climb stairs safely, and enjoy the activities you love well into your 60s and beyond. Thank you so much for staying with me until the end. I hope you found this video helpful and that it gave you clear, actionable steps to protect your strength and mobility after 60. If you enjoyed this video, don't forget to subscribe to the channel so you never miss new health tips and insights. Click the notification bell, leave a comment below sharing your thoughts or questions, and let me know which part of today's video was most useful for you. Your engagement helps us bring more valuable content right to your screen. Also, check out our other videos where we cover more topics about healthy aging, bone strength, and maintaining energy and independence as you grow older. Each video is designed to provide practical, science-based advice you can apply in your everyday life. And finally, always remember this important note. This content is for educational purposes only and does not replace professional medical advice. Always consult with your healthcare provider before making changes to your diet, exercise routine, or supplement plan, especially if you have existing health conditions or are taking medication. Taking steps today can help you stay strong, confident, and independent tomorrow. So start small, stay consistent, and make your health a priority. Thank you again for watching, and I'll see you in the next video.